Hello, we're just going to give everyone a few more seconds to get logged in. We'll begin the webinar in just about 20 seconds. Well, I think we can get started on just a few technical items. First of all, we want to welcome all of you to today's webinar. Before our panelists begin, there are a few technical items we do want to cover. If you have a question, please type it in the question and answer box. We will have time to address questions toward the end of today's discussion. Live captions are available in Zoom and have been enabled for this meeting. To turn on, click on the Other Options menu at the bottom of your screen. It looks like 3 dots. From there, you would click on Captions, and that would choose to turn on live captions or to receive the full transcript. If you need to make the font larger, you can click on the up arrow on the side. You click on Accessibility, then Closed Captions. And then you can use the slider to change the font size. The contents for today's event will be shared as a recording following its conclusion. We will share the full slide deck as well, so please keep an eye on your email to get that information. We will now begin by hearing welcome remarks from Stephanie Beckhorn, Director of Michigan's Department of Labor and Economic Opportunity, Office of Employment and Training. Hi, Stephanie.
Good afternoon. As Mike mentioned, I am from LEO's Office of Employment and Training. Employment and Training is focused on developing customized workforce solutions for businesses and individuals, including those with disabilities. And we are comprised of 3 areas: the Bureau of Services for Blind Persons, Michigan Rehabilitation Services, and Workforce Development. Our services to support employers and businesses include partnering to recruit, upskill, and retain valued employees, providing incentives to increase the bottom line while building an inclusive and diverse workplace, and helping connect employers with job seekers to meet their needs. And I am proud to say that most of the resources are free. May is Mental Health Awareness Month, which looks to raise awareness about mental health, fight stigma, provide support, educate the public, and advocate for efforts to support the millions of people in the U.S. affected. At LEO, we believe investing in mental health and safety is critical to build strong workplaces, a strong workforce, and strong communities. Employees and employers across Michigan are encouraged to review mental health in the workplace resources and build on mental health strategies that will have a long-term positive impact on employees' well-being, your bottom line, and our state's communities. Today's content is intended to get you thinking about resources and efforts you as employers could implement in your workplace to support or improve mental health amongst your staff. Our panel-style discussion will highlight programs and real-life examples of employers and organizations that are using these tools in and throughout Michigan. I'd now like to welcome Sean Egan, LEO's Deputy Director for Labor, to share a few words. Sean?
Well, thank you so much, Stephanie, and thank you and the Employment Training team for having this panel discussion and giving me a chance to chime in a little bit. So as Stephanie mentioned, I'm the Deputy Director for Labor. I oversee a lot of our regulatory agencies, including MIOSHA, Workers' Comp, Wage and Hour, and the Bureau of Employment Relations. But about a year ago, our director, Susan Corbin, and I talked about mental health. The governor talked about her state address. We're having great conversations all over the place about mental health. And we wanted to focus on workplace mental health. And what we were talking about there is not much of the great work that you see from Employment Training and Michigan Rehabilitation Services and Bureau of Services for the Blind, where they're helping people with known disabilities get into the workplace or stay in the workplace. We just wanted to look at the workplace generally and kind of see what's happening as a result of the pandemic. just as a result of work, stress in people's lives and other things, and kind of how we're responding to that and what it means for the workplace. So I was able to lead a work group last year composed of big business, small business, labor unions, and professionals. And we developed a report we released last May and have done a ton of follow-up and webinars across the state, either virtually or in person, to talk about our findings and what we're trying to do. And within that report, we had 9 recommendations for the state of Michigan, and then a handful of things that we thought employers could do to get started. Because most importantly, some of the things we learned is that it's clearly a journey and not a destination. I know for a lot of employers, we're looking for policies and procedures, sort of things that we can implement, and we know they're going to work. And for a lot of these things, we just don't know that. We know they're going to help. We know they're going to make an impact. We know they're going to make a difference. But there's no X, Y, or Z, and everything will be fine. We're going to have to continue to make modifications, evaluate, and look at what we're doing and make them better. So as an example, a lot of employers have employee assistance programs, but generally and statistically, only 4 to 5% of employees will ever use those. And those are a great resource for employees to find support that they may need, but they're not being utilized broadly. Now, we talk with employers that have high utilization rates. We talk with employers that have low, but statistically, those programs aren't working as well as we want them to. So we need to think about that and try to figure that out. We know that chronic stress in particular is a significant cause of anxiety and depression. A group from Stanford evaluated kind of the genetics of depression. For those of us on that might be a little bit older, we think about mental health, and we have this perception that these are genetic dispositions. These are things that just happen to people and they're going to be lifelong. Well, a mental health issue might not be lifelong. It can be very fleeting. Depression is not always permanent, and these things can change. And what Stanford found is that they believe they could link maybe 40 or 50% of depression that we see in our society to genetic characteristics, meaning the other 50 to 60% are coming from other sources. That could be community sources, it could be work sources, it could be poverty, racism, it could be some of those things, adverse childhood experiences that create these situations where our response to the stresses in our lives is going to be different. In chronic stress in particular, we spend a lot of time on that in the brain science of chronic stress. We have a nice webinar where we talk about that as well. Is one of those issues that we have to manage that can make us more resilient. So we talk about a lot of terms. We talk about mental health, we talk about resiliency, and we're going to talk a lot about resiliency today. But resiliency is really what we're doing to teach people how to respond to stress. So when our stress response engages, our thinking part of our brain almost shuts off. It's not entirely, but it almost shuts off. And our emotional thinking and that adrenaline and cortisol just sort of take over. It's the old, you're being chased by a bear in the woods. The stress response from that is engaged to help you stay alive. But that stress response doesn't really recognize the difference between that type of stress and something in your life or in your work that's causing stress. It can respond the same way. And being more resilient means we're seeing it, we're recognizing it, and we're using our logic center to shut down that stress response and help us move forward. So a lot of the things we'll talk about on the panel can be tied to all of these things. And what you're going to hear about is that flight, fight, freeze, or fawn response, and how once that's engaged, as a human being, we can't move forward until we shut off that stress response. So that's it for many of you. That's that person that's been a great employee for a long time that suddenly just isn't performing. Something's going on there that's causing that person to be in a position where they can't move forward. So we have resources we're going to talk about. Not only did we release a report, we got some things we're going to cover a little bit later that you can utilize, and some great information on the business case and otherwise, but we are very excited to be engaged in this space and part of this discussion today. And I think at this point, I'm going to hand it over to Nasha, if she has joined. She has, to lead us forward. Thank you.
Hello, everyone. My name is Nasha Ely. I am a woman with bluish purplish glasses. My hair is twisted and off to the left, and I have on a black and white top this afternoon. I think I'm having some computer issues, so I'm going to hopefully not lag too much as we move through this. So today with us, we have, Sean Egan is going to stay on with us while we go into the panel. And I am going to briefly introduce our panelists. So we have joining us Erin Wallace, Jamie Ashby, Gwen Mogenborg, and Linda Olenichik. They will provide information additionally about themselves in just a moment. So thank you all again to our panelists who are joining us to share these opportunities and resources for the employers today as we are wrapping up Mental Health Awareness Month. All righty, so again, thank you for joining today. And I'm going to start by asking each of you if you can please tell us your names, the organizations that you work for, and your role within the organization, and why the topic of mental health and wellness is so important to you. And we can start with Erin, please.
Thanks, Nasha. Good afternoon, everyone. I'm Erin Wallace, the project manager for the Stay Well program, which is a free mental wellness resource offered through the Michigan Department of Health and Human Services. And the topic of mental wellness within the workplace specifically has been and is really important to me for a variety of reasons, but ultimately having that supportive workplace really allows for each employee to be able to reach their highest potential. It encourages them and offers supports to manage that stress, that chronic stress that Sean was just speaking about, and really then allowing them to succeed within their roles, building resilience, and allowing for them to experience less work-related stress in their life outside of work.
Thank you so much, Erin. And now I'd like to move on to Linda.
Well, thank you. In my role as Director of Research at ASC, an employer association in Michigan, I speak to HR professionals daily at our member organizations about how it is affecting them, both the well-being and productivity of their employees. So creating a respectful and supportive environment around mental health will help organizations recruit, retain talent, increase productivity and performance, reduce absenteeism, turnover, and enhance their overall employee engagement. So at my job as Director of Research, I really want to help my member organizations get to that point of having a respectful and supportive environment around mental health and break that stigma. Personally, I've been affected by friends who have suffered dearly. So I now sit on a board at TheraCare Foundation. They provide prevention, education, and community awareness associated with mental health services in Southeast Michigan. And they're helping to break that financial barrier that helps stopping people from getting the help they need. So obviously mental health problems can have serious consequences for not only individuals, but organizations and society if not addressed.
Thank you so much, Linda. And we're going to move on to Gwen.
Hi, good afternoon, everybody. Gwen Mogenberg. I am a Director of Human Resources with Miller-Knoll, and we have found for many, many years the importance of mental well-being is on par with physical well-being in order to have folks be able to perform at their highest level, which we've already heard about, and ultimately help our business to be successful, is creating and maintaining a space where mental health can be a discussion and the support is available, whether you're at work or at home, is something we found is truly valuable to be able to provide as an employer.
Thank you so much, Gwen. And Jamie.
Yes, thank you so much for having me today. Hello, everyone. My name is Jamie Ashby. I work for AAA, the Auto Club Group, where I'm the Wellness Programs Coordinator. And I believe that taking care of our mental health is core to our physical health. When we think and feel better, we naturally do better in life and at work. As humans, one thing that we have universally in common is our mental health and the struggles that we have with it, no matter our walks of life, our economic backgrounds, or our status. And life as we know it is not always great all the time. And it is okay to struggle with mental health. Breaking down that stigma surrounding mental health and having those tough conversations and admitting there is a problem, the quicker we can come up with a solution. This pertains to our personal life and in the workplace. Breaking down the stigma of mental health has been a mission that I will continue to combat, to foster a safe place for conversation to be had and to be a resource. So
Thank you so much. And Sean, I'm not sure if you wanted to address anything else with that question, or do you think you're okay as far as why it's important to you?
Yeah, absolutely. So I think a couple of reasons. One, first and foremost, right, as I mentioned, I oversee MyOSHA, which is workplace safety and health. And when we think about people being engaged in their workplace, that's critical to making sure that they perform safely and making sure that they are seeing hazards, recognizing hazards, and able to make sure that they don't get hurt at work. We know that employers are trying to manage that, but it takes, not only the rules and procedures, but that worker has to be engaged. And a lot of the data is showing that they're not. And that's scary for me, right? That people are putting themselves in a position where they can get injured. The other piece is that we really think about it as systems. I think we certainly want individuals to get help. We want to keep breaking down stigma, but the data is pretty clear that the majority of people that could use help are not going to get it. So thinking about the workplace as a great intervention point and how we can create the systems that are going to be able to help folks without us knowing it's actually going to help folks. So there's a lot of reasons why it's important, and I'm just glad to be here today.
Thank you, Sean, and thank you all for sharing that information. So as we move into our first question, this is for Erin specifically. And the question is, why is mental health and wellness important, and how can it impact an employee in the workplace? Additionally, how has mental health changed over the past 3 years?
Thanks, Nasha. That's a big question with a lot of detail, so I'll try to summarize it as best as I can. But mental health and wellness is it's incredibly important for all of the reasons that the other panelists have shared, and the different entities that we look at within mental health and wellness. And we're seeing a variety of impacts within the workplace currently. There was data that was published by the American Psychiatric Association that employees with unresolved depression experience a 35% reduction in productivity, contributing to a loss of the U.S. economy of about $210.5 billion per year in absenteeism, reduced productivity, and medical costs. And so when looking at and really talking about overall wellness, each of us have a variety of dimensions of wellness that contribute to our overall individual wellness. And these areas include social, emotional, occupational, physical, intellectual, spiritual, and environmental. And what we know is that if you have an imbalance in any of those different 8 dimensions of wellness, you'll see a negative shift in your overall well-being. And we've seen a large shift in decline in overall mental wellness, specifically throughout the COVID-19 pandemic. On a day-to-day basis, we're not always thinking or thinking about, oh, I'm experiencing an imbalance in this area of my dimension of wellness. We don't think in that way. Most of us anyway don't think in that way. But all of these dimensions of wellness, they're so interconnected. And so what we do know is that individuals that are experiencing that imbalance may tend to feel just off or anxious. They may be experiencing depression. Or as Sean mentioned earlier, living in a state of freeze or fawn where they're just not able to be able to move forward. And so what this translates to is a 500% increase, or 5.4 million people that were saying, hey, something's not right. And they were taking a mental health screen. There's a free resource through the Mental Health Association online. And that happened in 2021. Where we saw that increase. We also saw individuals through that same resource, the highest amount of people reporting suicidal ideation since the survey began in 2014. And so what we're seeing is that, yeah, these challenges and these issues, they were present prior to the pandemic, but the COVID-19 pandemic really gave a pretty harsh shove in a lot of these different areas, and it's really exacerbated a decline in overall mental wellness, and it's had a very negative impact on individual wellness. But what it's also done, instead of just talking about all the negative, is that it really has also helped us to begin to destigmatize poor mental wellness in some. And it's really creating platforms for us to speak out more about this and to talk more specifically about wellness plans and wellness within our workplace, something that we probably wouldn't have seen or really even considered talking about 10 to 20 years ago. So that was a pretty long answer and to in some detail to some of those complications that we're seeing and the challenges that we're experiencing right now.
Thank you, Erin. I will say some of us are experiencing some technical difficulties. I was just booted off, so I'm joining now from my phone. I'm going to stay off camera and still try to come back on the laptop, but we can move along. So I appreciate you bearing with our technical issues. Our next question is actually for Sean and Linda. So we can maybe start with Linda.
Okay.
What is the business case for companies to invest in having resilient workplaces?
Well, organizational support is going to be critical to building that behavior. I think Sean kind of alluded to the fact that we're necessarily born with certain things that help us be resilient, but I still think we need to be taught how to be resilient in certain situations, or else that fight or flight will just be triggered. So organizations that are making resiliency a priority will see an increase in their employee well-being, their employee engagement, which they can track by doing annual engagement surveys, job satisfaction and creativity, and higher productivity in their employees. Those that don't find they're going to put organizational support into resiliency, resilient workplaces will see a decrease, or excuse me, they will also see a decrease in work stress and organizational burnout. So if you're wondering, well, what is support? What is organizational support? It can be training sessions and workshops that focus on a resilient growth mindset, psychological safety. So people feel safe giving feedback. People don't feel like they're going to get reprimanded for offering their opinion. Stress management and coping strategies. We mentioned employee assistance programs, but as Sean stated, those have their own challenges, and even some of the input, like trying to get someone to get in through the EAPs, are taking 5 to 6 weeks. So if somebody needs some assistance, you might have to use several employee assistant type programs. Offering work-life balance initiatives, so flexible work or remote work, career development opportunities for everybody. Again, you have to be consistent and universal. Recognition and appreciation programs are just some of the types of support you can offer. And Sean can probably agree to this, that HR is feeling this too. So you can't just dump this entire initiative on HR's lap. According to our 2023 HR Trends report we do with our partners at McLean & Company, 34% of HR professionals reported experiencing more stress compared to 2022. And so this initiative really has to be taken by just senior leadership down, but at every level in every department. I'll hand it over to Sean.
Thank you, Linda.
Yeah, and Linda, thanks for saying that. I always like to remind everybody, we talk with a lot of employers, and it's typically like HR or executives or otherwise, and remind them all, this is all happening to you too. Like, don't thinking about our employees, but this is all of us. Like, we're all in a very tough spot. But when we think about the business case, as Linda shared, there's a lot of reasons. So the survey says that's where employees see the greatest amount of stress in their life, that they say. Now, I always remind everybody, we don't have stress buckets. So if I had a bad day at home and I come into work and you ask me, like, what's your number one stress? I probably might say work, even though it might be the other thing. So there's no bucket where you shut these things off, but that's what employees say, and that's where we are. So my colleague Randall that works with me tells it better than I can. He said, in any given day, he'll be connected to me for 8 hours. And in that same day, he might actually see his family for maybe 1 or 2. So who's in a better position to kind of be engaged with that person and see changes in behavior and help them? But employers you're already paying for it. Whether you see it or not, you're already paying for it. You'll see some of it in healthcare premiums, but depression and anxiety account for 27 or more lost workdays annually, some $250 billion to the economy versus roughly 8 or so for those that are not experiencing anxiety or depression. And keep in mind, those folks that have those symptoms or conditions are still going to come to work. So then you have presenteeism, which never shows up on your bottom line, but costs you about, from Tufts University, $109 per employee for every one person that has that condition. And that's the most expensive chronic condition that's showing up in the workplace in terms of presenteeism. And Tufts also found that it varies by region, but you can just guesstimate that about 10% of the folks that work in your establishment are suffering with one of those conditions right now. So if you have 200 people, you got 20 that are that are showing up, missing time, presenteeism, $109 per employee in that establishment. So it's going to cost you a lot of money. But on the flip side, as Linda said, and I'll wrap this up, Nasha, I'm sorry, I'm going to get long-winded. Gallup survey showed that employees that believe their employer supports their mental health are 69% less likely to search for a new job. Retention. They're 5 times more likely to advocate for you as the place to work. Recruitment. They're 71% less likely to report experiencing burnout. Productivity. They are 3 times more likely to be engaged in their work, less injuries, more effective. And they are 36% more likely to be thriving in their own personal life. So whatever you did there is having an impact out in our community. So the stats are just great. And you get about $4 back for every dollar you put in. So hard to go wrong.
Thank you. Those are great examples. And I really appreciate the stats because the numbers to me make it make sense. And those were awesome statistics. So now that we've heard from Sean and Linda about the business case, I'd like to move on to our businesses that are here representing their organizations. And just kind of start with Jamie to see, how did your organization start the conversation to begin promoting mental health and wellness in the workplace? I think specifically, like, that is your job title. You don't see that very often. So
Right, exactly. So really good question. So at the height of the global pandemic, COVID-19, and the swift organizational changes we faced, we knew that it was necessary to create a wellness program centered around mental health. We realized that wellness looks different to every individual, but we designed a wellness program around 6 pillars that would be mental, physical, growth, financial, nutrition, and community. Monthly, we bring awareness to these pillars and encourage employees to get involved through our corporate communications, through our internet hub that reaches just over 10,000 employees. We began doing lunch and learns on various topics, promoting activities that promote mental health, and bringing in subject matter experts. We recently just had a keynote speaker, Deshauna Barber, come in, a former Miss USA and former captain of the United States Military Reserve, and she was able to speak to her own mental health struggles and was able to give really great advice on how she overcame them, and also great pointers for us to take away. So through this, from a wellness aspect, we are connecting with our employees, visibly fostering the notion that we are together for mental health, and just really creating a safe space to have open conversation. I think you're muted.
yes, talk about stress at work, because I was just kicked off for a second time. So I'm glad I'm on my phone too. Whew, okay.
Well, you are handling it
Thank you
very
so
well.
much, Jamie. Not on the inside. Thank you very much, Jamie. And I'm saying that is awesome how proactive the organization is in seeing, looking forward, not being stuck in what was going on right then, but what do we need to do to make sure everyone is well? So that is awesome.
Yes.
And Gwen, what has your organization done to start that conversation?
Yeah, thanks for asking. So mental health awareness has been part of Miller Knoll's culture for a really long time. So I don't know that I can answer exactly how or when it started. What I would suggest, though, is we have this belief that it's important that employees can bring their whole selves to work. So if you think about that concept, it means that individuals have to be able to be open. If I want to be fully present and be myself at work, this means I need to include discussion around my mental health and the support that I might need from my employer, my leader, my colleagues, so that I can be that person and be myself and be present fully in the workplace. So let's face it, the war for talent means that employers must hire and recruit from diverse pools and diverse individuals. And I really believe that in order to do that, we have to provide a diverse support for that range of individuals. And I think that realization is likely where our conversation started and subsequent programming that we have in place as well.
Thank you. So I'm going to move into our next question. And to be honest, you guys have already hit on a lot of this. So if there's things maybe you didn't mention before, feel free to mention it now. It sounds like your businesses have already done this, but what could a business do if you're talking to like a business to business type of conversation and an organization is like, that sounds awesome. What can I do? I don't have 10,000 employees. You know, I have a much smaller business, or I'm a HR department of one. Like what can a business do to support their employees and encourage that good mental health and wellness throughout the organization? You know, if they don't already have something established, if they don't know where to start, if they kind of just don't know what to do, like this webinar is great, but what do I do next? What would you offer as some suggestions? And if we can start with Gwen, that would be great.
Certainly. So we found in order to support our employees, we really did need to start by preparing our leaders. And again, this can look differently depending on the size of your organization, but engaging leaders in a way that helps them understand how to approach individuals, not only who are experiencing maybe a mental health crisis, but also just in general about, again, destigmatizing the concept of mental health. So we believe in making the topic really of mental health a routine part of our business conversation. In doing so, acknowledging the normalcy around mental health, removing that stigma, as I mentioned. So in addition to preparing leaders, providing programming, and again, it can be simple, but for employees in support of this concept that mental well-being is important. Annually, we provide a survey that in part collects aggregate information on the mental well-being of our employees. So they self-share information about how they're feeling, how they are arriving at work. And that really does help provide for us information on what kind of programming we can support. And I would suggest any size company can do that as long as the information is aggregated so that no individuals may be called out.
Thank you. I love the fact that you said it doesn't have to be something big. You know, because that's one of the things we hear often is, I don't have an HR department, it's me and my generalist, that's it. What can we do? It can be something small. It doesn't have to be this grand thing. It doesn't have to be a whole ERG. It doesn't even have to be a whole position that someone takes on. A lot of it starts with the normalizing mental health and wellness. And like you said, making that the conversation that people have and are okay with having to reduce the stigma. So if that's one employee having that conversation who happens to be in HR because there's no one else, that's fine. And if it's a group of employees who want to develop an ERG, that's fine too. But I think your point, Gwen, is kind of, you have to start somewhere. And if leadership is the start, which it should be, then if you normalize it there, hopefully that'll trickle down to everyone else. And Jamie, what would you suggest to a business that might have that question?
Yeah, so I think that visibility is important around the workplace supporting mental health and wellness. Posting content on monitors throughout the office and monthly wellness initiatives, I believe, fosters an environment of good mental health and makes employees feel supported at work. And it shows them that it is a safe place where they can have their thoughts and they can reach out to their leaders for thoughts. I think that continuous mental health education with our leaders is so important to have employees feel supported. I often recommend to our leaders taking the mental health first aider certification, as it really dives into great details on how to be an intentional leader and notice signs of individuals struggling with mental health. I also believe that employee recognition balances and promotes healthy mental health as we know it, just as employees ourselves, when we're recognized, it makes us feel good. And it changes the thoughts of, am I doing my job good enough? And makes us want to continue to be our best. I also believe that having a no meeting Friday, no camera Friday eases into the peace of the weekend. I also think that wellness is reinforced when we're able to connect at work by promoting wellness events in person, such as yoga, meditation, or a fitness session. And similar to what Gwen was saying, our organization posts surveys out twice a year, just so that we can be intentional with the work that we're doing and making sure that our employees feel supported.
Those are awesome ideas. I love the fact of bringing people together too. That the camaraderie, when you create that culture where people feel safe, they'll feel more comfortable having those conversations. And, you know, whether you're a large or small company, to do I love the no camera, no meeting Friday. I hope my bosses are listening. We should implement that. That would be a welcome addition to the weekend, right? But something that simple could make a huge difference for someone. I always say, by the time Friday comes along, the week has caught up to me. I'm exhausted by the time Friday rolls around, mentally, usually physically, even though I work at a desk, because you're just drained. So something like that is being very intentional about the wellness and health of your employees. And I think that is awesome. You guys actually gave me ideas that I think we should bring to our self-care and wellness ERG and take back to our own leadership here, because those were great ideas, and you don't necessarily need to formalize that or have a panel of people to do it. It can just be starting these conversations. Hey, even this month, we're going to try it out. We're going to try this month. I love the word pilot. We're going to pilot a no meeting Fridays for 1 month just to see what it looks like. So thank you both. Those are great ideas. And I hope other businesses can gain some information like, hey, that is something we could maybe try out, because one footstep at a time, it doesn't have to be a huge thing. So those are those one little footsteps to make a difference. We still have some time. So if Linda, Aaron, or Sean want to chime in on this question, that's great.
I can throw out some information from our members that we, share with them. We have a Wellness Wednesday email that goes out every week. And a lot of that information you can, if you're in ASC, you can garner the information from us. But also there's free things on the internet like actionforhappiness.com. They have monthly calendars that you can send out to your remote and in-person employees, and with an action plan for the month. So there's a lot of things that you can do without a budget. Like everybody said about engagement surveys, but if that just seems very overwhelming, we don't want to create more stress, do a focus group. Come up with some questions of and find out what they really want to do. So you're not putting your money into something they don't need. Maybe they all have the Peloton app, so they don't need a physical app to do exercises, but they would love a lunch and learn by a financial institution to come in and help them save for their kids' college education. And that could be free. You can get a group to come in and do that. But as we've all said, training, but you want to make sure the managers and supervisors know the signs of mental health. Sometimes the happiest people are the ones that are suffering the most. So you want to make sure they know the signs and effective ways to communicate. And in fact, you guys will include an article I just wrote that was published today on that in the follow-up email to everybody. Internal communication, like we were stating, Jamie was saying, like employee awareness campaigns. Again, sometimes your EAPs and your benefits provider offers you free material that you can go ahead, and you guys have that wonderful mental health toolkit that's on your website that offers a lot of great downloads. So you can use that. And then also, I think, Nasha, you talked about your ERG. So start an employee resource group focused on mental health and well-being. And again, outside of that, HR, right? Let HR do HR and get your whole department, all your departments in on that employee resource group and drive positive change in your environment.
Thank you, Linda.
Nasha, I would just say, so we've been doing with the labor group, the No Friday meeting thing for a while now, and it's very helpful and everybody loves it. So it's been going pretty well. So we've been doing all of our work with a focus on, and I think Erin in her work would agree, like a focus on how you pull this down to the smallest of the small employers. So everything we're trying to build is recognizing that larger employers are going to be in a little bit different position to be able to manage some of this. So we're trying to create a universal, but our goal is like, here are the resources you can implement. But first and foremost, I think regardless of your size, the stats are pretty clear. Employees have to be engaged in the process. So just ask them. If you can't do a survey, just talk to them. And then as an employer, don't take it personally if they tell you they think you are the problem. Like maybe the way that they work is the problem, and be open to suggestions and input. I think when we talk about the stigma and having a place for voice, we have to be open to that kind of feedback as well. Now, all of us on the panel and everybody on this call, we work hard. We're trying to do the right things. We think we're doing the right things. But it hurts sometimes when somebody says you're not doing it right. It feel like we are, but we need to be open to that kind of feedback as well. And then what we see a lot, and what I hear a ton, is our poor folks in the middle. Our middle managers are getting squeezed so hard from both the top and the bottom. They're really stressed out. The data is clear on that, but that's where a lot of employees see the rub. Like, I can't communicate with that person. And we need to really think about how we support those folks too, to both what I think Jamie mentioned, the mental health first aid and those other tools so they can see it. But also, like we said, it's happening to all of us. And it's happening in a big way to those folks too. They're kind of in the middle of organizations getting crunched pretty hard. So we got to be mindful of that as well.
And Sean, you're right on that. What a lot of our member organizations call a feedback chat, where you make the time for everybody, management, to go talk to their staff and ask 3 simple questions. How are you doing? What are we doing that we can help you? And maybe it's something on professional development. Everybody just, as Jamie said, wants to feel like they matter and have a voice. And that is just a huge pathway to success in getting, clearer picture on how everybody's mental health is. Just 3 simple questions. And I can always provide anybody with that resource too.
Can you please? Because I think those 3 questions are fabulous. They're non-threatening too.
Correct.
Which is always good. All righty. So you guys have been awesome and given a lot of resources and information already. So you have shared a lot of resources, but are there some resources that your individual organizations offer to your employees, specific for Gwen and Jamie? I've heard of some businesses paying for Headspace memberships or the Calm app or things like that. But are there any things that you are specifically doing, providing, like, everyone has the Headspace app, everyone has the Calm app that we pay for your employees at your organizations? And then after that, I'd like Sean and Erin to dive a little deeper into the state resources that are available. And the first question is for Linda, Gwen, and Jamie.
Okay, and we're talking about different resources, correct?
Like very specific resources.
Yeah.
So you're a little different because you're a membership, but I know something that was done through your membership for your members was you had us come in and do some mental health and mindfulness training.
Correct.
And then went back and, did what they needed to with their employees. So,
and then we also partner with 2 different groups. One is called Burn Along, and it's a corporate wellness platform. So it features thousands of on-demand and live streaming classes. So it covers fitness, mental health, and financial wellness. And what's really nice about this is if your employer purchases it for all employees get 4 sub-accounts. So they can share it with family and friends. Let's say you're an international company, or you're a company with just a location in, say, Tennessee. You can work out with a friend that moved from Michigan to Tennessee and have challenges amongst each other. Another partner that we just partnered with is Workplace Wellness. If you were at our ASE conference in March, they were also there, and they can help you fully run personalized corporate wellness programs for small and mid-sized businesses. So this one is, maybe Burn Along is too big for you, but workplace wellness is somebody who could assist you. And again, if it's something that you just want to do with a lunch and learn, there's a lot of situations out there for financial institutions. I know MESP will come in and do lunch and learns. I can also, Nasha, send you a list of different ideas for that you can send to everybody, because the wellness can be, or well-being, not only mental, physical, but financial. And there's even mortgage companies that'll come in and talk to people if you have a need, so that they can feel more comfortable about downsizing or buying their first home. I mean, it really spreads the gamut, and that's why those surveys and focus groups are so important, so you know where to put your time and effort.
Thank you.
Yeah, so kind of very similar to what Linda was saying here at my organization. We of course have our EAP, the Employee Assistance Program through LifeWorks, where employees and their families can log in for resources and whatever topic they may be struggling with or need support with. They're able to actually call and chat with a real licensed therapist 24 hours a day, 7 days a week. We also have partnered with the Calm app. And while we've not been able to give all of our employees them, we've used them as incentives for our wellness program. And it is, so if I remember correctly, each employee gets up to 5 dependents on their Calm app subscription. And then we also support our ERGs. We collaborate efforts with them as it relates to wellness. And we think that's a great thing because it connects coworkers and leaders to share common interests and promote in-person community events. We also do bring in speakers as it relates to financial wellness. Following the COVID-19 pandemic, finances may look different for everybody. So those are some resources that we have. Our insurance plans, if employees participate in them, it will cover a certain amount of sessions with a mental health professional. And then of course we partner with fitness centers across our footprint where employees live.
Thank you,
They can
Jeannie.
get
Those
like
are awesome
discounts and
resources.
different incentives. So
Thank you. And Gwen, are you doing anything specific as a resource for your employees?
Yeah, so a lot of the things that were already mentioned are similar for us. A couple additional things, and I'm glad somebody earlier mentioned psychological safety. We focus on the concept of psychological safety with leaders, and then they're able to funnel that concept down with their employees. Again, recognizing that the concept of being able to speak openly and freely in a manner that you're not worried about retribution, of course, is really, really critical. We also use content founded in the Be Nice program, and that's a foundation for us here. And in addition to the traditional EAP program, we partner with an agency called The Source, and they're fantastic because they function as a liaison to lots of resources in our communities that we might not be aware of existing, and they provide that to our employees. So I think those are all just additional great resources that we provide.
Thank you so much, Gwen. Those are awesome. And then over to Sean and Erin as we wrap up.
So the Stay Well program offers a variety of free resources that supports mental wellness for individuals through a variety of different entities with workshops, webinars, free counseling services. But one initiative that we've recently launched is a free mental wellness toolkit for organizations. So especially for those organizations that don't have anything in place or they don't really know where to start, we've done that legwork for you. So it's a pretty comprehensive toolkit that is completely free of charge. It's available on our website. And I believe, Nasha, you're going to link out some information about that and where folks can find that later, but it really will take the legwork out of it for you. You can use the toolkit in its entirety or bits and pieces that you're needing to use to supplement different entities within your organization. And really our tagline, it's still, for 3 years, it's been the same, but it's be kind to your mind. And so we're really wanting to encourage individuals, leaders within organizations to be kind to their mind and encourage folks to be kind to theirs as well. And so The resource has ways to start a program, and supports for management staff. There's also scripted presentations that you can select to use that has everything scripted out for you, takes all the legwork out for you. So it makes it very easy, kind of a plug and play is like what I like to call it. So that's available for free and on our website, and there's things that are being added to it pretty regularly as well.
Thank you so much, Erin.
And I'll be brief because I know we got to get to the Q&A, but I think, so michigan.gov/workplace mental health, that's a landing page we've created for what we're doing. Staywell and Erin have partnered with us on all of this work pretty much, and providing that resource is just critical. So we love it. We do a monthly webinar series, third Thursday of each month at 2 p.m. where we kind of bring on different people to talk about different issues and how they manage them and all that kind of stuff. So in June, we'll have the Michigan State Police that'll talk about how they manage trauma that happens in your workplace. You think about cops, firefighters, nurses, first responders, right? They're going to experience trauma through their work and how they manage that. So some of those kind of critical issues. And then we have links to a lot of other resources, including federal resources like Surgeon General, which is great. OSHA is focused on workplace stress, and they have a lot of great tools and resources available. So you'll see a lot of that from us as well.
Thank you so much, Sean. All righty, so as we wrap up time, I'm going to pass this back over to Mike for any Q&A. And again, thank you to our panelists for joining us today.
Thank you, Nasha. And thank you, panelists. We actually have just a couple of questions I'd like to pose to the panel. The first one is, are there resources for company standard operating procedures? Don't know if any of you would be prepared to take that, especially perhaps maybe Jamie or Gwen. And the caveat is, and if not standard operating procedures, possibly company policies.
So Michael, I could jump in just briefly. I see Gwen went off mute, so I'll try to be brief, Gwen. When we were doing our work, we found two groups that had really focused in on the space. The Chicago Resiliency Network, which was a corporate-led initiative with consultants that would actually go into companies and work with companies on looking at standard operating procedures. And then one in New York that was a public-private partnership that did something similar. So as I mentioned, it's sort of a journey, not a destination. I think one of the things that we would talk about and talk with employers about is, let's look at your standing operating procedures and make sure that some parts of that are open to the concept of mental health. So can you use a sick day without notice for mental health? Can you use a PTO day without notice for mental health? Like some of those types of things are helpful. And there's other things that we talk about too. So we live in a just-in-time world that creates a lot of pressures on everybody within an employer to perform at a certain level. Is the workload too much? Is there better ways to allocate work? How is our paid time off policy? So there's a lot of these types of things, but there's really no X, Y, or Z and everything's good. So that's the only point I'm trying to make.
Well, that's excellent. Anyone else?
Just, review and update your policies to ensure they support mental health and well-being. If you haven't looked at your policies in a while, they may be missing the mark. So I'll see if I can find some tips and tricks for that too, Michael, and send it over to Nasha.
That would be
Yeah,
great.
and just to kind of piggyback off of what Linda said as it relates to those policies, I know that for our leave teams, if an employee is struggling with mental health, that is definitely taken into consideration. Employees, they have an option to take a certain amount of days off to support a personal leave and whatever they may be needing that for. So that may be something to explore.
Okay, thank you. One other question for the panel, and that is from a business standpoint, how have employee wellness priorities changed over the last 5 to 10 years?
Yeah.
I mean, Gwen, are you in agreement? I don't know if it was a priority.
Yeah, you know what? I think there's been such a significant shift, and very, very quickly, which we're grateful for. And I think we can point, to a lot of reasons for that. You see, I think, a lot more discussion around mental health on the news when we're hearing these really drastic and scary events that can happen around our communities. But I would say that, we felt a swing, maybe as recently as 8 years ago, and then with the pandemic, I think this topic became even more heightened and a lot more awareness. So it's happened quickly, drastically. It's necessary, and I believe that a lot of organizations are really kind of fumbling to say, what resources can we use? How do we do this? And my call to action for everybody is, don't wait to get it right. Step foot in, take a stance. It's okay to be a little fumbly, but there's nothing wrong with entering in, to talk about how important mental health is for everybody.
Yeah, if there is a silver lining from the pandemic, and I actually see a few of them, like this issue is one of them. And I think it's largely because we all feel terrible. Like we all went through the trauma together, and Erin can actually spend a great amount of time on how we deal with trauma collectively and how long it takes for us to come back out. So we're in a good position to do that. We've certainly seen from young people, the whole hustle culture kind of pushback that's going away. And the way I always phrase it is, frankly, we've just changed our mindset now to where we're putting the human back into the human resource. And we're starting to recognize that we just can't function at the levels that we think we can. And that we're being more mindful that, hey, it feels weird to us to say that less hours is more productive, but the reality is less hours might be more productive, and that we can function at a higher level by being just more attuned to how we're treating our brains.
Thank you, panelists. We really appreciate it. I think I'm going to turn it back over to Stephanie now for some closing remarks.
Thank you, Mike. And thank you, Nasha, Sean, Erin, Jamie, Gwen, and Linda. I hope what we shared today gets our participants thinking about the next steps that you as a business can take to support mental health and well-being in your workplaces. As we wrap up today's event, we want to quickly share with you some websites that you can visit if you'd like to learn more about what was discussed today or pursue some other next steps. First, the Michigan Department of Health and Human Services Stay Well program, which Erin shared with us. Also, check out Leo's website, Mental Health in the Workplace. And lastly, please also check out Leo's employer resources page, which can be found at michigan.gov/back-to-work. Back to work. This page gets you access to a variety of resources for employers. These include immediate and long-term workforce solutions. The website also includes an intake form where you can get connected to other employer engagement team members quickly to help assess your workforce needs. Please also stay tuned to your email or for follow-up information from today's event, including a link to the recording of today's presentation and the slide deck. You will also receive a survey as you exit the event. We appreciate you taking a few moments to complete it so we may discover the types of topics we should cover in future meetings. Thank you very much, and I hope you have a fantastic day.